Welcome back, everybody, and we're now moving into our panel discussion. So I have the really easy job this morning. I actually get to chair the panel rather than get faced with the questions that I'm sure you're all going to fire at our panel today. Hopefully everybody's feeling energised after the workshops and they've been thought-provoking and giving you some ideas and some questions that you would like to raise with our panel. I'm joined by John and Angela, who you've already met, and also Jackie McGinn from Western Bartonshire Health and Social Care Partnership. Some of you may have been along to Jackie's and Joe's workshop on community planning Western Bartonshire's whole system approach to substance use prevention. And also joined by Pamela Smith, who's here on behalf of the Scottish Local Authority Economic Development Group. And Pamela also facilitated a workshop on local government's delivery of sustainable, inclusive and economic growth. So the purpose of the discussion is really to focus on our strengths and to look at how we build on those strengths, which were really comprehensively outlined by Angela in her presentation. As Angela highlighted, local government are providers of key services which have a direct impact on health and well-being, such as housing, planning, leisure, recreation and environmental health. Angela also outlined a number of challenges for us around about inclusive growth, population and the environment. But certainly what I took from Angela's presentation was a call for action. How do we build on our strengths? How do we make sure we don't become complacent? How do we look at those services we provide and the additional levers that we could use much more effectively to improve our population's health? And how do we think of our leadership role and what are we going to do going forward to act as leaders within place and within our public health system? So I'm hoping you've all got lots of questions lined up, but I would like to kick off with one. And as we know, public health reform is a collaboration between national and local government, and certainly in the workshop I was at, some questions emerged and some challenges round about that relationship and the connectivity across the public health system. So my kind of kick-off question to the panel is, how can national and local government work more effectively together to create the policy environment to deliver improvements in population health? It's an easy one to start with, isn't it? So John, I can see John heading to the mic.
So how can national and local government work together was the question. So I guess our role at COSLA is to make sure that, for a start, that national and local government do work together as much as possible in setting that policy framework to allow local work to flourish and achieve the right outcomes that we want for our communities. I guess the first reflection that's on my mind, because I was at Jackie's workshop around the work in Western Bartonshire, I was really quite inspired by that to hear about the really good work that's going on between agencies there that really puts communities at its heart. And throughout the presentation we received, I was kind of thinking it sort of sounds as though you've got it going at a local level, which is really good. And I was thinking, from a national perspective, what do we actually contribute to this? But then there were a few things in that presentation around strategies that have been published over the past year, and it felt to me as though the message, and from your colleague Joe as well, was that those strategies that came from a national level were actually helpful in some cases in putting messages not necessarily towards local government but to some agencies of government and just the broader system around the sort of direction that we want to go in as a country. So I guess I was encouraged in listening to that to hear that sometimes those national strategies really do have an impact at a local level and can act as facilitators. I also think as well that there's something about local government working at a national level with the Scottish Government, not just to look at how we can enable and encourage good work at a local level, but to look at what barriers might be put in place by either national structures or bits of legislation. And I think that as a kind of national stakeholder in all of this, I think that is one of the responsibilities that we have as well, is not just to think about how we can drive change and certainly not to think about directing from a national perspective, but to look at what levers are held at a national level that we can pull to free up some constraints that might exist at a local level that will then enable good work to happen locally.
Okay, thank you, John. I just wondered if Pamela or Jackie wanted to add anything from I suppose, a local delivery perspective.
Yeah, thanks, John, for that. I agree with what John said. We know that locally, I think we're already, and probably a lot of other local authorities or community planning partners work closely with national colleagues already. And what the national public health priorities that John was alluding to, the publication of that helped strengthen our work because it formalised it going forward at local community planning level. But we've been heavily involved as the public sector reform gathers pace with the new body, going to be established in April, and we were heavily involved in work to be developing the national priority because they're shared priorities, and we were able to take that to a local area to see how we're going to all work together collectively. And it did come out at the right time, it was timely and helped support the work we did locally. But I would like to think that, as we gather pace, there's opportunities for the national body and local government and community planning partners to do even more shared work together around the national shared priorities, and hopefully the shared priorities are built around the wider determinants of health, so we know that the vehicle for delivery is community planning partners, and as Angela alluded to this morning, is local government departments. So it all does fit and it all feels right, but I know there's more work to be done depending on the size of your local authority, and luckily one of the things about Western Berkshire is we're quite a small local authority area. So, and Angela, I know you're in Aberdeen, but Glasgow City have got particular challenges with the size. So we're a small local authority area, so there's lots of opportunities there for us, and we're maximising those at the moment. So, thank you.
Yep. I was just going to take it a slightly different dimension and look at how we articulate the golden thread between the national priority and the local delivery, because we're all signed up to the national priorities, and we were talking in a group around the messaging, how do we get across more generally that the health of the public is everyone's responsibility, as opposed to this view out there that public health is still some kind of institution. And it's about food safety and environmental type things, as opposed to the whole health and well-being agenda. So I'm interested in how we work together to better articulate the priorities, and in operationalising them, how we get to some shared measurement framework, because what gets measured gets done. And I think if we can collaborate on that, then that would be really helpful.
Okay, thanks very much. So that was the warm-up question. I'm sure you can all do better than that. So we have a roving mic, which I think is mine. So if anybody would like to ask a question, if you could just put your hand up, Mark will come over to you, and if you could just say who you are and where you're from, please.
I'm poised. I'm ready.
I know, we're ready to run with the microphone.
Hi, Jo Clark, Five Volunteer Action. You touched on measurements, and we obviously have the lovely term flourish. We've got to understand what sits underneath that, and I think we're all well aware of the other tensions that come into that. Have you got any thoughts on what you would like to measure?
Probably not definitively, because it would. These are really difficult things once you start getting in and about the guts of it. And if I look at it from an economic perspective, I think we're missing a trick in not measuring the economic well-being. But like any measurement framework, unless we actually articulate and define what we mean, because sometimes when we stop at the measures, we're all measuring different things and it's meaning different things. So I think we have to work back from, well, what impact is it? So if it's about reducing health inequality, and we heard earlier around the drivers in the past, do we need any legislation? What are the drivers and how will that shape the measurement framework? If we can be focused on the ultimate impact and then kind of work back from that. And to me, it is, one of the biggest issues is tackling the root cause and the determinants, because we're so busy with less money mitigating the impacts. How do we get the space, the time to actually deal with the root cause?
Question. So my answer would be a couple of things. What influences whether you're flourishing today, as distinct from my institutional lens, are two different things, aren't they? And it's all based on life events and what's going on. But as a state, collectively, we are drawing into trying to measure, because in exchange for money, we have to be able to show that we're making a difference. I would like to get to a point where actually we stop all our single service agency volumes of reporting that we do on single agency delivery, and actually we move to a whole system outcome framework. And in theory, our LOIPs allow us to start to move in that direction. At a local place level, we've come on, and I would echo colleagues, I think the first important relationships are your local, and will make a difference to people's life through the value of the relationships we have at local level. And that's probably far more important, bluntly, than sometimes the relationships we have at national level. But I think it's about how we move to take our LOIPs and then say there's an outcome framework that we're going to put in place. And actually the conviction to say, come what may, regardless of government agendas, we're saying as a place, in collaboration with our communities, these are the priorities we're going to stick with at least for 10 to 20 years. And we're going to give ourselves the grace and the freedom to measure those things on a long-term basis, and understand that there are things that we can do, that we plant seeds, and they might take 10 to 20 years, but we're going to stick with these things. I think about how you change the fabric of a place. I mean, we're physically regenerating Aberdeen. That will continue long after I'm dead and buried, if we want to have an impact on people's lives. So I think it's a multi-agency outcome framework. We've been looking at Public Health England's approach to that, saying actually, how do you put the LOIP and then your multi-agency outcome document at the top of your hierarchy, and then encourage ourselves, the single agency with government, to relegate the importance of some of our single agency record-keeping, reporting, metrics that go on, that in some regard they're meaningless, because they show a single lens on an outcome. And the reality is there's not an outcome that's in the National Performance Framework that any one single agency can do. And yet we have an audit and inspection regime that's still focused on individual sectors. It's trying to move on that multi-agency. We have a suite of demands on us as local systems to produce annual reports and to do reports. Let's move to a multi-agency, because that's the reality. And then nirvana would be to then actually have money aligned to that on a place level, not on a single agency. It's meaningless distributing money by single agency, because actually you then are focused first of all around delivering all of that. So we're really serious about outcomes. Then we've all got to pitch our money together. And we're all trying to work in that way at a local level that demands some braveness to say, I'm going to put the greater good first before the single agency, but all the accountability systems are completely geared towards us as single agency. So I think it's quite a challenging question about how we measure the flourishing of an individual. I think the most important thing is start measuring how well children are flourishing. And if we're not setting ourselves targets around saying no child will grow up to smoke, and our colleagues from Arch Scotland, so a child born in Scotland today, let's have an ambition that says they won't smoke, they won't drink, and they won't be addicted. And if you come back to Christie, he said, be bold like that and design your system to strive to that, and then have your accountability systems aligned to it. So my plea is, let's start moving to multi-agency outcome frameworks that that supports the LOIPs, if we have genuinely moved the LOIPs into being the local expression of the public health priorities, if they genuinely are that, then an outcome framework that supports that, and a reduction of the amount of single agency accountabilities that we have in place. So actually we spend more time holding each other to account at a local level for the achievement of those outcomes. But those outcomes will not be delivered on a one-year basis. And whilst we still sit planning on that, money's allocated on that, while all that still happens, we won't make these kind of shifts. So we need some freedom that says, allow the outcome frameworks and the measures to take some time and to embed, but make that the top of what we spend our time on, rather than so much of the single agency stuff.
Thanks very much, Angela. And that probably, I suppose, links to the first question that was asked, just in terms of an ask, in terms of what we would want the performance management reporting arrangements to be like for public health. Okay, who else would like to ask a question?
I'm not 21 anymore, so I can't run fast.
Thank you very much. I'm Margaret Douglas from Edinburgh University, and I ran with Sheila Duffy the workshop on health and all policies. And we were having health and all policies is an approach to policy making that is about systematically considering the effects of any policy on health and trying to get the best health outcome from that you can. And we were having some discussion about what would help to really implement health and all policies in practice, and I'd be really interested to hear the panel's views on what would really help us to implement health and all policies in Scotland.
I'll maybe pick up on a couple of things in our workshop where we were concluding that we maybe had to do a health impact assessment when we were looking at economic development investments. But that led us into looking at all the other duties around child poverty, equalities and fairer Scotland. And again, maybe coming back to the point about the whole system and the one agency, maybe we need more of a global way of approaching the health and well-being, and that we can assess the impact on any activities, any programmes or any investment priorities. So I think health, we have to find a way making health everyone's priority, but it is about the health and well-being, and it's about all those equalities, fairer Scotland, whatever. Do we need another duty? And if not, how can we coalesce all of that around the one measurement framework again, which is all about, you know, inequality, whether it's health, income, or otherwise.
I was just going to say, I guess, so I'm no longer new in my role. I can't play that card, but having been in not for very long, 18 months, health and all policies was, if I'm really honest, a phrase that I probably only started really hearing about 18 months ago when I came into this brief. And it took me a while, and I wouldn't say that I'm an expert on what that necessarily means, but it took me a while to, I suppose, get my head around what health and all policies was really all about. And I think that in response to the question about how we can kind of make that a reality, the only thing I would say would be, I think that it is a phrase and a movement that sometimes requires a little bit of sort of unpicking to really understand what it means and what it can mean for you and what your contribution or benefit to it might be. And I think that work is best done at a local level within the community planning partnership, where there can be a conversation about what do we really mean by health and all policies. And I think that conversation has been quite successful nationally, and I'm sure it's been successfully locally in some areas. But I would encourage, I guess, community planning partnerships and other groupings to do the work to understand exactly what that sort of stuff means, and to have a shared understanding of those things before any action takes place.
I stumbled across it as a concept. I mean, I genuinely did. I was at a King's Fund event. I stumbled across it. I'd been a bit curious about planning. I just thought there was a kind of power to planning. Of course, it enables economic development, but I thought there was more. So I just started Googling it and tried to find out a wee bit more around it. I think it's significant, isn't it, around if you take your economic strategy for your city region, you take your spatial plan, and then you take your children and adult plans, and for us that's the heart of our LOIP. If you put at the heart of all of that about Christie saying our core business is to prevent demand, because I guess that it could be mechanistic, the health policy, or you could say it's about how to deliver on your deliberate shift to prevention. And we had the opportunity recently with kind of government colleagues in the Cabinet Secretary to be able to try and describe our deliberate shift to prevention. And that makes you really think about, in that whole system, how you move it. So if you assume that our collective job is to make sure that all of our emergency and accident departments are redundant, now if you make that assumption, as opposed to assuming that there's a certain level of demand that has to go through that front door. So we started to get really curious about all of the demand that's coming into all of the emergency gateways, and whether that's police, fire, accident and emergency, and saying, if we all understood that and we all saw that data together, and I've never seen it, I've never, as a chief exec of a local authority, seen all my partners' emergency demand that's coming in. If you start to understand that and you say, actually, from if our objective is to prevent that demand coming in, then how do we design that in, and what then are the policies, the structures, all the governance that we do? So I've gone on a bit of a personal journey saying, it's right, it allows, if you understand its potential, and I've taken it into the LDP conversation, and that's been interesting. My head of planning's been really receptive about saying, we can use the lever. Of course it needs to be there to support the economic growth, because without that, and we've seen that historically, but there's another kind of potential from it. So watching that journey that we've gone on as two chief officers, taking that initiative around building health policies in is important. But then when we brought the DPH into the conversation, it was then saying, well, what is it you want to achieve? So it's not enough to say health policy sort of built in. What is it you're trying to achieve? Now, we'd happened to be at King's Fund event, and we got sight on what Amsterdam are doing and saying, so we're all wrestling with the amount of childhood obesity. So if we were saying, in a health policy and all, what is the role then that the LDP can play in the elimination of childhood obesity? Not just an incremental, but the complete and utter elimination. So I think it's an important tool to help us in the deliberate shift to prevention. And I think that's where, in my mind, that's where the leadership of local government now needs to come in to say, let's occupy the space of prevention. And it's right that the treatment system is there, NHS, and that's an invaluable asset that we have. But in our conversation with our health and social care partnership, and in the expression of our transformation programme, we got into a discussion about saying, actually, the transformation programme needs to reduce the amount of demand going into accident emergency. Let's quantify that. Let's start giving ourselves a target about how much demand we want to see coming out, and we'll only do that if we have the deliberate shift to prevention. Now, it all sounds really easy to do, and when you read Christie, you all go, God, that's just a no-brainer. Doing it and being committed to doing it is really challenging to do, and I say that as a chief exec, getting my system to move to say, we want to be there. I'm not saying we won't do the response stuff and all of that, but the system all the time, the weight of what you feel daily is that downstream stuff, isn't it? And actually, to get into the space of being the upstream, my God, it's a real task to get yourself positioned with your management teams, with your teams, to be saying, that's where we want to be positioned. I think the tool is incredibly important in relation to all of that. And I was really surprised and pleased when government dropped in the health assessment impact within the Planning Act, because it was saying to planners, you have one of the most important levers at your disposal. Let's make sure we're using that. But I think our job is to understand, and this was the conversation in our group, there are other levers. I don't think I'm using the licensing lever enough, but what public health colleagues have been saying to me is that they don't understand the levers. And I'm saying, I'm not sure I understand all the levers that I've got. So actually, if we just start doing show and tells, so we've got a show and tell this Wednesday, so planning and licensing colleagues are doing a bit of a show and tell, and then just clustering public health colleagues around the public health priorities to then say, and how would we use those levers? It's making the time to have that, understand your system. We all inherit systems, but it's understanding levers. So I think as an approach it's important, but not in itself. It has to be linked to what's your deliberate shift to prevention. That has to, and it can only be based on your own understanding of your own people, your place, and your economy, and what your own kind of community plan and partnership says. So I fell upon it, like the sense that it's now kind of been built into some of the fabric of what we're doing, but it can't be a tick box. If we were honest, a lot of the quality impact assessments are. A lot of these things, David, I say it with the greatest respect, I do, and we get a lot of these duties placed, and then we get a checklist, and we're kind of ticking. I think if you lift it up and say, what is your deliberate preventative strategy? When you go back to the architect of this public health reform, it said there would be a public health strategy. Well, that's our strategies. That's our LOIPs. And so I think the challenge is about saying, is your LOIP preventative enough? And if it is, how as a whole system are you going to move in terms of all of the strategies that you've got? So we've been clustering each agency's strategies to see how do they all sort of sit together and how do they connect up to the LOIP in order that we can make sure that all of our strategies are aligned. So I think it's a long-winded answer. It's an important tool, but not in itself. Otherwise, it's a text box. It's got to be as part of your deliberate shift to prevention. I think that's what our LOIPs are meant to be.
One final question, and then we'll leave for lunch.
Hi there, Elaine Young, NHS Ayrshire Arran. So for me, some of the power of public health reform lies in the synergy with some of the other big reviews that are going on at the moment. So care experienced young children, but I'm particularly thinking about the local governance review and what the synergies and opportunities are between public health reform and the local governance review.
Thank you. I think that's a really important question, and it's really important to bring the local governance review into the conversation today. COSLA and the Scottish Government are leading that jointly, I believe, at the moment, and we've been very clear going into that that this was about a review of local governance across the whole system, the whole of the public sector, and even beyond, and not a review of local government, which sometimes I think we can be sort of drawn towards. And I think that there are some real gains that we should be looking to achieve through the review of local governance, if that's about, as I kind of mentioned earlier, loosening up some of the constraints that might be on national organisations to be able to make a better contribution to local community planning partnerships. I think as well that conversation that we had earlier about what we're measuring and what we're being held to account on, understandably there are a lot of constraints in there at the moment that mean that we can't quite put that primacy on sort of multi-agency set of accountabilities that we would like to get ourselves towards, because there are other reporting mechanisms in place for Police Scotland or for the prison service or whoever it is, and as COSLA we would really like the local governance review to get into a really serious conversation about how there might be changes to governance right across the board that can allow for that joined up multi-agency working that we're looking for. I think that James is talking this afternoon, James Mitchell, and I know that he's been involved in the local governance review and in COSLA's contribution to that as well. So it'll be interesting to hear what we can discuss around that this afternoon as well.
Okay, thanks very much, John. I think Angela's coming in. Just a final word to Angela, and then we'll stop.
It's a slight oxymoron, isn't there? Local governance review being dealt with at a national level. So what's our CPPs about? They are about the governance of place and people, and your earlier comment, we don't do things to people, we do things with community. So I'm sure that there's that we will benefit from the review, and there will be structures, policies, system things and powers and freedoms and stuff that will come from that. Meanwhile, let's not use that as a kind of excuse not to do anything. We are the governors of our place, and so it's really important that we drive the public health agenda forward within our own partnerships, of which we are the governors of. I think it's about how we learn to work in a really collaborative and collective way, and I'm not sure that everybody knows how to do that, and not everybody commits at a local level with the same level of commitment, momentum and resource. And actually that can't be tackled at a national level. That's got to be tackled from the hard shift in the relationships that you have to build at a local level, and the permissions that you have to give yourself at a local level to say it's actually really important that you spend time getting to know. Often I would joke that I'd spend more time with my NHS Grampian in chief, the police and the fire commander, than I do my own team. But I actually think that's right, because I think that's where my job is as a kind of place leader. So whilst I'm sure there's synergies and we'll look forward to what comes back. Remember, there was a review of public health in 1999, and here we are sitting in 2019 again. So we mustn't allow kind of inertia to build in. These population and health issues that we're dealing with are here and they're now. You look at those kids that were protesting. Look, those kids were obese. That's the reality. They're fighting for a cause which is terrific. Who's fighting for their health in the immediacy of their health here and now? So I think it's always right to have all of these kind of reviews going on. But my own view would be, you are the governors of your own place at a local level. Just challenge yourself about how committed are you? How much time do you spend in that CPP? How much do you understand your other public partners and the levers that they've got and their agendas, and how much are you discussing together, actually how you move that forward? What will come from the review will be great, and hopefully I think that for me Public Health Scotland can sit really nicely between, rightly, the ambition for a subnational level of government who wants to drive public health and improve population health in Scotland, and us all as delivery partners. And I think Public Health Scotland, if we can mirror Public Health England away, was able to bridge that sort of relationship between the national powers and levers that a government has versus what we should be experimenting with at a local level. I think that's, for me, is probably the most important thing for us, and I think it's really important that we work with Angela and the executive team there to help to understand how we're going to get those relationships to work, and support Angela and the team to make some of the cases for some of those national levers. Meanwhile, supporting the test and the experimentation that hopefully Angela and the team will kind of encourage us to do. And that point about the evaluation and the monitoring all of that, you can see how Public Health Scotland can really help us with all of that. So I know there's a lot of energy going into local governance review. I think it's really important that we continue to put the energy to support Angela and the Public Health Scotland team, because for those wee kiddies that are experiencing obesity, that's the here and now. So I think we've got to make sure that we continue to support all of that and get the relationships right. We worked really hard on that for those that have been on the oversight board. Worked really hard at just saying this is a whole system, but we all have to learn how to work in a whole system. So we're going to have to kind of continue to work on that. So it's not to take away from the local governance review, but let's stay focused on the public health reform and helping Angela and that team to make sure that's a really useful and helpful actor that's kind of coming into our systems that are sitting at a local level, but recognising that there will be some things, and we saw that from Public Health England, there will be some things that a national body will be able to do that can make a difference. So, sorry, rant over.
Well, unfortunately, we've run out of time. So on behalf of everybody, I would like to thank Angela, John, Jackie and Pamela for their very thoughtful contributions this morning.